echo session on COVID-19 and COVAX data from the country, regional, and global views. It's on the top of the hour, wherever you are. We are going to give it a minute as folks log in from their respective computers before we kick off our session today. So we're going to give it one more minute as folks can log in before we start our webinar. Thank you. Okay, let's start with some housekeeping slides. Next slide, please. Today we have interpretation in French and Spanish. It's available by clicking the interpretation button. You can see a screenshot of what that looks like here on this slide. Next slide. We also have two features we'll be using for different purposes. The Q&A feature is for questions regarding the topic in the presentation. The chat feature is questions regarding IT, logistics, or the certificate of attendance. Next slide. We will also have live transcription. You can click on the live transcript and choose show subtitle, and a caption will appear. To close the caption, click hide subtitle, and there's a screenshot of what that looks like here. Next slide. There will be recording and certificates for today. The session is being recorded and your attendance is consent to be recorded. We'll share these recordings after the session in English, French, and Spanish. And a certificate of attendance is also available through the University of New Mexico via the link in the chat, which we will show at the end of the session. Next slide. Project ECHO takes data use quite seriously. We collect registration, participation, question and answer, chat comments, poll questions for some of the programs, such as the one today. Your personally identifiable data will be shared with the project funder, and this data may be used for reports or maps or communication, surveys, quality assurance, evaluation, research, and the like to inform new initiatives. Next slide. So before we get into announcements, we have a few poll questions that we'd like to put up on the screen. Echo India, if you could. Great, as folks are joining on, I might have messed this up. Oh, okay, great. So you should see a poll question on your screen. I'm going to read them to you and then ask you to answer. We'll do some announcements and then we'll flash up the results. The first question is, what best describes your day-to-day job related to COVID-19 response? Is it data management and data systems? Is it around program implementation and vaccine introduction? Or demand generation and advocacy, epidemiology, donor, or other? The second question is, in your day-to-day job as related to COVID response, recognizing that folks have been pulled off of perhaps their job title or their job description, what's the most significant data gap that hinders your ability to carry out your duties? And we have a number of choices here. Understanding what vaccine supply can be expected to be delivered, absorption capacity within a country or globally, costing and financing related metrics, including what the funding gap in a country is to support programs, vaccine competence related metrics, and disaggregated program related metrics such as coverage by key demographics. And lastly, delivery related indicators that may be related to progress or challenges. For example, quantification of human resource gaps or bottlenecks and the like to optimal vaccination. The last question for the introductory pre-session poll we have is, how familiar are you with the public availability of COVID-19 vaccine-related data sources? And please choose one. So as you guys are clicking on those, let's hit to announcements. Next slide. And so as as hopefully you know, since you signed up and you're here, today's session is on data. We have 2 remaining sessions in this second series. The one next week is on impact modeling. It pulls off of a SAGE session that occurred last month. And then the very last session of both the year as well as this series is the global status update, a year in reflection and a year ahead. We have a number of speakers from IBB, Kate O'Brien and Lindstrom, as well as from WHE, the Emergencies Program, Mike Ryan and Scott Pendergast. And so it's a nice kind of summary touch point for the end of year, as well as a glimpse into the new year. Next slide. The agenda for today will be an overview. I'll introduce the speakers along the way, a glimpse of WHO dashboards of the EGRF, the partners platform and new functionalities and data elements on there, as well as some data and insights from the COVID behaviors dashboards that's administered by Johns Hopkins. Next slide. The goal for today is to provide an overview of available data for decision-making to support immediate and medium-term goals. We'd like to share with you what data is available and on what applications and platforms, and describe where to find this data. Next slide. So there are a few announcements from today. You'll receive the slides thereafter, and so you can click these links. One is an enhanced readiness for Omicron, a technical brief, as well as some updated guidance documents around vaccine carriers, around job aids, around the respective vaccine products, as well as interim recommendations. And more information can be found at the CRD resources page. Web email. Next slide. Okay, before we go into our first speaker, let's put up the poll question results, please. Great. So in the first question of what describes your day-to-day job, we have a large proportion in data management as well as program implementation, as you can see here, trailing by demand generation, EPI, and others, with one donor here representing. In their day-to-day job, we see that the most significant data gap is around costing and financing metrics, as well as disaggregated programmatic metrics and delivery indicators. So the last 2 responses. And then with regard to the last question on familiarity with data, it looks like about half of our audience is somewhat familiar with the data, and then with the remaining half, not at all, as well as very. So thanks for the introductory polls. I'm going to close that out and introduce our first speaker. We have Donald Brooks joining us from WHO and the Country Readiness Delivery team, who will give us kind of an overview of the landscape of what's out there, setting the stage for highlighting a few speakers and a few data sources. Donald, over to you.
Excellent. Thank you, Angela. And good morning, everyone. Good afternoon. As Angela mentioned, my name is Donald Brooks, and I lead data and analytics for the Country Readiness Delivery work stream for the COVAX facility. Next slide. And as Angela mentioned, today, the goal really is to, there's a lot of data that's available on COVID-19 vaccination, progress, rollout, introduction, etc. However, often can be quite siloed and restricted to certain institutions. Though we're all very familiar that accurate, timely, robust data is critical to understanding, key implementation challenges at the country and district levels, to communicate on the donor end progress and by countries to raise awareness of challenges and advocate for action, as well as to drive recognition of key implementation successes that could be potentially replicated elsewhere and elevated as best practices. So during today's session, we'd like to highlight a couple of, or a number of rather, key data sources and analytics platforms across a good number of different global and regional partners, just a small sampling of those logos represented here, including World Health Organizations, Johns Hopkins, and others. Next slide, please. So quickly, before handing it over to colleagues from WHO and Hopkins, just wanted to provide a quick overview of these data sources, those that personally as someone in the day-to-day at the global level on using COVID-19 implementation data, those data sources on which I rely and others in similar roles have relied on of late. Those circled in red boxes will be handled by subsequent colleagues. So the first set handled by Laure from WHO, from IVB, and the second red box, the partners platform, handled by Angela in the subsequent chunk of the discussion. And I'll focus primarily on those partner dashboards shaded in light blue. Next slide. The first dashboard that, or data source rather, that I'd like to highlight is the WHO IMF COVID-19 vaccine supply tracker. So this platform engages very much at the supply side of the question, tracking vaccines procured and secured or expected across countries, working closely with manufacturers, with COVAX and other multilateral distribution agencies to understand which countries or economies have remaining gaps in terms of expected supply to COVID-19 vaccine doses. This data set is deliverable as well, and they also do forecasts. This group does forecasts through the end of the year and monthly thereafter. The link for all of these quick deep dives are available on these slides, which we shared in the chat afterwards. Next slide, please. Another quick overview is the UNICEF COVID-19 vaccine market dashboard. Similar to the WHO IMF dashboard shown previously, this is very much at the supply side of the equation, but bridges this question of delivery, those doses that have arrived physically in country, which for many, especially from recognizing doses are coming from a large number of different sources. At the global level, this is what we've observed to be the most complete assemblage of this information that provides disaggregation by COVAX doses and groups non-COVAX doses as total additional deliveries. And this is available per country and also highlights expected deliveries through the end of the year through the COVAX facility. Next slide, please. The COVID-19 Task Force vaccine dashboard is coordinated through a group of multilateral institutions, notably the World Bank, the World Trade Organization, WHO, and the IMF. A high-level overview of a good number of different metrics related to vaccine implementation, including doses required to reach targets, estimated doses secured or expected to be delivered, daily vaccination rates, and daily COVID-19 tests. And this is available and displays per country profiles of this summary information. Next slide, please. And then finally, before handing it over to Laure, or back to Angela first, to discuss more of the WHO-specific deeper dive dashboards, the final is the UNDP Global Dashboard for Vaccine Equity. Uses many of the previously mentioned vaccine implementation indicators like population coverage and vaccination rate, but mixes them with recent socioeconomic information to look at vaccine equity and to ensure the equitable distribution of and rollout of COVID-19 vaccines globally. Again, all of the links to these dashboards are on the slides, and we'll hand it over to Angela to take us to the next section of the session. Thank you.
Great. Thanks so much, Donald. Thanks for putting this together. We recognize that we can't distill the ocean today, but we wanted to give you a smattering of what's on the menu and highlight a few of the dishes. There was, as a reminder to you, put your questions in the Q&A feature. I see folks jumping on the chat. Welcome to everyone. We've answered one question, and let's see if folks have any other questions. I encourage you to put into the chat box. We're not taking live questions today unless you have a completely burning question. And so why don't we transition on as folks think of any questions that they may have to our next speaker. Next slide. I am pleased to introduce Laure from WHO. She will be talking about WHO dashboards and the EJRF. We're really happy to have you here from IVB. Laure, over to you.
Thank you, Angela, and good morning, good afternoon, and good evening to everyone. I'm very pleased to be given the opportunity to make this presentation to you today, and especially to focus on what are some of the main dashboards where we have more deep dive analyses, and we are putting some data for you to be able to download on COVID-19 vaccination in the WHO member states and reporting entities. So as Angela said, my name is Laure Dumollard. I work in the immunization department at the World Health Organization, where I am mostly responsible for immunization data from data collection from WHO member states and reporting entities. So speaking of data collection, WHO is collecting data on COVID-19 vaccination through various mechanisms, mainly to serve the various needs to monitor the disease and the vaccination and vaccine implementation in countries. And then this data is displayed in various dashboards, and this is what I'm going to present to you today. Next slide, please. The first one you may be well aware of is this one, which is accessible from the WHO webpage, and it is displaying COVID-19 data on cases, deaths, and vaccination uptake. For the vaccination uptake, it provides interactive and nice visuals on the number of doses administered, the number of persons vaccinated with at least one dose, the persons fully vaccinated per 100 population. The dashboard will also allow you to see which vaccines are in use in which countries, and for each country, the number of vaccines in use. Some summary analyses are available at WHO regional office level, but there are also some country and territory or area level analyses, which you can see. And of course, the underlying data is downloadable and it is updated on a daily basis as data is flowing to WHO headquarters from the WHO regional offices. Some of the regions are collecting a bit more than what is shown is in this main dashboard. And this is why they are displaying this additional information in their dashboard. And this is what I'm going to present very briefly to you now in the next slide, please. So as you can see, the 6 WHO regional offices have developed their own dashboard. And the main addition to the HQ dashboard is to provide vaccination uptake by specific target groups. So this is what you will find in those regional dashboards. The WHO regions, in an effort to diminish the reporting burden, on countries, are also very often supplementing their data sets that they're receiving from the Ministry of Health by what they can see in the Ministry of Health website and in other public websites. So this has given them the opportunity to provide additional data, especially what I said on specific target groups. I'm not going to show you this dashboard one by one, but you will be given all the links except the one for the Western Pacific region, for which it is restricted, it has a restricted access. Next slide, please. So the dashboard I would like to focus on today is one so-called vaccination module that you can see here on the slide. It is accessible from the WHO Immunization Data portal and provides a rich set of visuals and analyses of the data, which is mainly reported by WHO member states and reporting entities through the eGRF. And I will describe what the eGRF is and how we collect the data through that mechanisms in a minute. The main added value of this dashboard is to provide data on many other aspects than the ones I already mentioned for the previous dashboards, namely on procured doses, on policy data, on some main system indicators, on evaluations for COVID vaccine implementation, in addition to disaggregated vaccination uptake data. I will do a demo of this dashboard in a minute. So let me first explain to you what is the source of the data which is displayed on this dashboard. Next slide, please. Over the past 20 years, even more actually, WHO and UNICEF have collaborated to collect together data on immunization. The data collection tool is named JRF for Joint Reporting Form. And in 2021, the form moved from an Excel-based to an electronic. So this is what you can see, the change from the Excel to from the GRF to the E for electronic joint reporting form. The collaboration between WHO and UNICEF, I have to say, has been extremely successful, as it was just permitting to the two agencies to have the same immunization data sets that they are working from and displaying. And it was also very successful because it was diminishing the reporting burden on countries, asking only once per year the data to all their member states and reporting entities. In 2018 and in 2019, so pre-COVID era, I should say, to illustrate the success of the form, 100% of the member states reported immunization data through these mechanisms. So it is really a well-established and accepted data collection tool. And this is why, given this great success, in early 2021, it was decided that the tool would be used to collect data on COVID-19 vaccination. Effectively, the data which is collected on a more regular basis than the one which is collected through this tool, meaning monthly, is not enough at the global level. Data on vaccination policy, procurement, cold chain, information system, etc., are needed at the global level to be able to contribute to producing the standards and the recommendations, which is a core mandate of the WHO, right? To monitor the global situation, especially for COVID-19 disease and COVID-19 vaccine implementation, and to be able to target efforts where it is more needed. So this is why the subset of data which is collected on a more regular basis and goes to the main WHO dashboard is not enough to be able to fulfill this mandate of the WHO. And this is why we decided to go for a monthly reporting mechanism using the joint reporting form. Next slide, please. I'm gonna fly through this one, but just for you to understand how the data collection goes. So every 15th of the month, the eGRF portal opens a new questionnaire asking countries to report by the last day of the month. And countries are asked to report data up until the last day of the previous month. So just to illustrate, on 15th of November, we opened a questionnaire asking countries to report data up until the 31st of October. And they have to report this, by yesterday, meaning the last day of the month of November. And then we use the following 2 weeks before we reopen a new questionnaire for the dedicated data review, data validation. But even if we are doing this data review and data validation, the data upon reception, actually less than 24 hours after being received, is immediately pushed on the dashboard. So this process is important for you to understand, for example, that for the time being, we are still in the process of collecting data up until October, and this is what you will find in the dashboard, though we are already in December, and we are eager to know what is going on with the data for November, which we will receive a little bit later. Next slide, please. So for the questionnaire, we opted for a tailored approach, meaning that we have some questions which are applicable to the 213 countries to which it is sent. But we also have some questions specifically for AMC countries. We also have some questions that are only for countries belonging to a certain region and more precisely to a certain WHO region. And we even have some questions which are only for one specific country. In an effort, on the top of it, to diminish the reporting burden, most questions are pre-filled after the first completion, except some data that cannot be borrowed from the previous month, which is data on uptake and on the number of IFI. The questionnaire is reviewed every month, and if necessary, it is modified. And you know how COVID changed from the beginning of the year, and for the time being, for example, we are now interested in collecting data on vaccination among less than 18 years old, or even now children. We are interested in collecting data for booster doses administered. So these are examples of new questions that were recently added to the questionnaire. The vaccination uptake data, which is collected here, is quite interesting because it provides lots of disaggregation. It provides vaccine uptake by vaccine types, by age, by specific target groups, and also by gender. You will see that in a minute on the portal. But as I mentioned, it does not only allow to collect data on vaccination uptake. We also have questions on vaccine policy and vaccine availability, on procurement, stocks and stock utilization, on acceptance and demand, and many other topics, which we can have a look right now. And if the ECHO team in India can give me the rights to share my screen so that we can have now a live demo of the dashboard. So I'm not sure how I do it. I am going to check if you are trying to tell me something on the chat, but I don't have a control panel here.
As Laura is trying to sort to the shift, why don't we take a quick look at the two questions? There's a question here about the best CCE that should be used when transferring the vaccine to rural areas where there's no electricity. I'm not sure that's the scope of the experts here, so why don't we put that in the parking lot and we can get an answer from IVB thereafter, since the experts we have today are around data and data management. So I'm going to table that question for now.
Okay, so just to say, I don't seem to have the rights to share my screen. Unfortunately, I've put some backup slides which are hidden on the slide deck, so maybe we can show them, because I really don't seem to have the rights to share my screen.
Yes, you have the rights. As soon as you will just click on the share screen button, you will get the option to share your screen.
Okay, now I'm seeing the share. Yes. Okay, here we go.
All right, let's see.
So you should be able to see my screen now. Let me please confirm.
It looks like it's, yes, we can see. You're ready. You're cooking with gas. So why don't you proceed?
Okay. So this is the famous dashboard I was talking to you about, and I'm delighted to be given the opportunity to tell you all what you can do with this dashboard. So first, you will land in this introduction page where you can see the number of countries for which we have data. And here I want just to warn you to interpret this figure with a lot of caution, because the data which is displayed on this dashboard comes from the EGRF, as I explained, but we are also pulling some data from other sources because we are having a very low response rate on the EGRF. So I mentioned to you the great success of the EGRF for the past years, but in the EGRF, we can also see the huge fatigue, reporting fatigue from countries on COVID-19, and which explain why we have fewer countries reporting through the EGRF. So in order to provide a better global picture, the data that we are displaying on vaccination uptake only is complemented from other sources, and namely the daily or weekly data reported by countries. So this is very important because this is a real limitation on what you would be able to get as analysis when you are in this dashboard. So if you want to understand a bit more how we are doing with this extra data and how we plug it, please go to the metadata. Everything is explained. You can also, everything that I am going to show to you today, you can also click on this download data feature, and you will access this page that will allow you, when it loads, to click on those arrows and to be able to download absolutely every single underlying data which is displayed on this dashboard. So in this dashboard, we have country profiles, regional profile, and other information. Let me start with the country profile. Hopefully we will see, if I set it up correctly, the data from Côte d'Ivoire. The fact that I shared, it looks like it's coming slowly, but I hope you can see it now. And this is the data from Côte d'Ivoire. So as you can see on those country profiles, we have a full and rich sets of visuals that help you understand the vaccines which are in use and their starting date for each of the countries that you can see here on the left panel, the number of doses procured by vaccine type, the procured doses also by procurement mechanism. So you can see the procurement mechanism from this slide, and then a set of visuals on vaccine uptake, either be it by month, and you can see here that Côte d'Ivoire is reporting every month to WHO and UNICEF through the EGRF, and you can see the doses, the one dose, those that received at least one dose, and the fully vaccinated, and you also have the line for the fully vaccinated per 100 population. You also have cumulative doses received, and for like Côte d'Ivoire AMC countries, we also are requesting the number of remaining doses which can be displayed. And this is where this dashboard is unique, although as you can see, we have some reporting gaps. You can see data on vaccination per by age group, and I'm going to slowly go down to Qatar and show you a bit this data now. You can see vaccination data by target group, and Qatar only is giving us for elderly people. Otherwise, you would also have for people with comorbidity and health workers. So the age group, you would have by vaccine product. And you can see also some analysis on gender. And for Qatar, you can see here the difference between male and female vaccination. And of course, here you have the number of IFI. If I'm scrolling down quickly, you can have for each of those countries, and this is again the great richness and added value of this dashboard, information on some policies which were taken by the countries. So for example, priority target groups per and vaccination supply per, there are information on vaccine policy And as I mentioned earlier, the most recent one on vaccination of adolescents and children and the booster doses administered. There are information on vaccination strategies, and we are receiving more and more requests if campaigns are used as delivery strategies. Those that are interested in knowing this is available from here. Acceptance and demand, safety, supply management and cold chain wastage. All this data is available country per country on this dashboard. So, and the same type of analyses are also available by region. So it's compiling by WHO region, and I hope it shows on the screen. Yes, and you can also filter not only by WHO region, but by World Bank income status. So for example, if you are only interested in the data for Europe countries belonging to the EU, Euro or WHO region and high income, you can do this both selection and you would get this information straight away. And then you would have, again, information on procured doses by procurement mechanism, vaccination uptake per 100 population. You would have information on vaccination of health workers, of elderly people. Yeah, and this is what you would get on this dashboard. The uptake data disaggregated by gender, and of course, all the other additional information which I mentioned on vaccination policy, safety, vaccine delivery strategies, acceptance and demand, and so on and so forth. So again, a lot of data is already available here, but again, all this data needs to be taken with a lot of caution, because we have really a suboptimal response rates. I know there are people from the Ministry of Health here in this assembly. I want to thank you very much for reporting this data through the EGRF, if this mechanism is familiar to you, because I know that it is a reporting burden. If you are using the EGRF, you know that the burden is really on the very first time when you are reporting, and after that, it is quite quick because there is this pre-filled mechanism. But yet I want to thank you very, very much and encourage everyone to continue reporting this very, very important data to us. Thank you very much for the opportunity to showing this dashboard, Angela. And now I'm giving you back the floor.
Brilliant and perfectly on time. So we have a few questions. Laura, if you could stay on. So one question, thanks Donald for putting in the Power BI dashboard. Yes, it is accessible to all, and the link is in the Q&A box. We have another question. Is the data in the EGRF including all deliveries of the partner and the purchase of the government directly? It speaks to whether or not the data capture of the vaccine doses. I'm not sure if you could answer, but did you want to try?
I'm not sure I fully understood the question. So we are collecting in the EGRF the source of the procurement, so we would know if it comes from COVAX, AVAT, so we would know the number of doses per vaccine type, and depending on this procurement mechanism, this source. So is it bilateral agreement? Is it AVAT? Is it COVAX? So this is what we would have. I hope I'm answering the question, and I'm happy to go and check on the chat or on the Q&A the question, and to spend a bit more time to think about it and give a more detailed answer.
Great, thank you. If I may paraphrase, the countries report and you present the reported data by the source of vaccine financing. And so
yes, this is, I think I'm still sharing the screen, right? So this is what I'm showing here, procurement by procured doses by procurement mechanism. And this is in the Côte d'Ivoire example, we would see that COVAX is the most
Great, thank you
used
for that.
Yeah.
We have two more questions. One is, how is the received data processed and how is it used for future improvement?
So the data, how it is processed. So the data is reported in this web application that we call the EGRF, and through an API flows directly into the WHO main data warehouse, which is called WiseMart, and then the dashboard. Here, this is the Power BI dashboard, reads directly from the main WHO database. The way it is processed is that we have a set of validation rules, which are set up by the data collection tool, to be able to do some pre-automatic validation of the data. And we have a series of experts which are reviewing on a daily basis the data reported by countries and have, through the tool, the EGRF tool, a direct access to the Minister of Health and be able to ask the questions on the data that they're reviewing and they are working from. And then we are providing the feedback on the data received through the dashboard by publishing the data we are receiving. The only piece of information that we keep confidential and that we do not publish is the pricing. We get some data from countries and we're very, very thankful. It's a very important information to help understand the global market on vaccine prices and COVID vaccine prices. But this is the only piece of information we consider confidential, which is not published. All the rest is published on this dashboard.
Great, thank you so much. We have one last question for you. What is the role of headquarters or RO, I'm assuming that's regional office, in developing country-specific dashboards?
What is the, I'm not sure to understand the question. So of course, everyone is super interested in understanding the situation country by country. As I said, one of the main WHO role, besides setting the standards, the recommendations, besides monitoring the global situation and the health trends, is to provide technical assistance to countries. So having this country dashboard is very, very useful to understand the situation in the countries and to be able to target the efforts where they are most needed. So this is one. The second is, of course, this is linked to all the other analyses which are done on the global market for COVID-19, which is also country tailored. Those analyses are country tailored, and it is also very important for donors to be able to see where where the doses are going and if the people are being vaccinated with the given doses.
Thank you so much, Laura. If I could point you to the Q&A, there's some pretty straightforward questions there, if you wouldn't mind. Why don't we hand the, and thank you so much. Why don't we hand the control back to Echo India and let's move on to the last two presenters. So Echo India, if you could shift to the next slide, and thank you, Laura, for a great presentation. Following on to Donald's also great presentation. So as the slides are getting kicked up, what we're going to shift to a bit is on the partners platform, which is run by WHO Emergencies Program in collaboration and cooperation with the COVAX partners, as well as closely with WHO IVB, Immunizations, Vaccines, and Biologics. Next slide. When the COVID pandemic hit, countries were preparing strategic preparedness response plans in order to address the wholeness of the pandemic, not just the vaccines element or domain. And so as part of that, the operational arm of the SPRP, or the Strategic Preparedness Response Plans, was the Partners Platform. It was conceived early in the pandemic to support these response plans. And about a year into the response, Pillar 10, the vaccine and vaccinations pillar, was created to support COVID-19 vaccine deployments. The partners platform anchors itself on 3 functionalities. One is uploading country plans. In the case of vaccines, we're all quite familiar, that plan is the NDVP. The second main functionality is to capture resource needs, whether or not the country used civic tools or other costing tools to characterize what those needs are against their NDVPs. And the third, as we've heard from other speakers today, is to capture donor resources to be able to fill those needs in countries, recognizing that the response has taxed all countries at the country level, regional level, and the global level. Next slide. So our vision is to facilitate these vaccination programs with a focus on the 92 AMC countries. And the goal of the platform is to have a secure digital space, not only to house information, but to exchange and utilize country-facing data toward this end. There are 3 kind of elements that are buckets that the platform houses, and from the perspective of loosely defined country users and donor users. And the first objective is to fill the needs to provide a country by country profile, contextual data streams similar to many of the variables that you saw presented by Laura around supply and program indicators. The platform is also very important in that it's where the NDVPs are housed, as well as the civic sheets that cost and estimate cost and needs for countries. A second bucket of data or information is data around donors and residual funding gaps. And those are somewhat more financial indicators, money indicators, with the intent to provide an overall global view as well as a country's specific view of their needs and what the donor contributions are currently in country from a wide range of all sources that we can get our hands on: multilateral development banks, bilateral collaborations, things of that sort. The third objective of the platform is to serve as an application platform, literally. It serves as a mechanism to apply for funding requests for operational delivery, specifically for the CDS COVID-19 delivery support window or envelope that's being managed by Gavi as well as UNICEF, depending on the type of country. The types of indicators that we look there are utilization indicators, process indicators, where things are along the application process. Next slide. And so for many of you, hopefully you've been on the platform, and there is a bit of a facelift, recognizing that there's a lot of data, as Donald queued up this session on, and perhaps difficulty into organizing and framing where to find that data, as well as ease of use. And so what we've done in cooperation with a number of users is we developed a quick access guide. If in advance of logging into the platform, you could take a look from perhaps a country's perspective on the left-hand side, or the donor's perspective, or other additional resources. And then so all of the ones that are outside of the platform, you don't need to log in order to view. For example, the WHO regional dashboards, for example, the UNICEF market dashboard labeled earlier. I have orange arrows here to highlight new data elements that are on, which we'll take a look at shortly. Those are country profiles. Those are the interaction reviews that have been authorized by countries to share. And those are the WHO regional dashboards that many of you have probably been using for a while. We've put them kind of all in one spot. I know it takes me a while to find things. And then also our last speaker will feature the COVID behaviors dashboard administered by Johns Hopkins. Next slide. And so after you log in, you have access to more things. Next slide, on the menu. And so the same quick guide pops up for ease of simplicity. Next slide. And if I feature the country links on the left side, thanks to Sophia for putting this nice deck together. Next slide. There are a few screenshots to kind of show you what these look like. And so hopefully to entice you to log in. And so on the left-hand side, I feature a few screenshots of the 9 domains or 8 domains in the country profile dashboard. And so the data elements in there include vaccine introduction, as well as a few sentences on implementation insights, supply secured and received, as well as product utilization, vaccination rate, population coverage, and absorption capacity and forecasting data. So some elements overlap with previous discussions, some not. And so it's all in kind of one spot. There are other things such as the NDVP and civic access points to upload, as well as downloading the CDS application and support. On the right-hand side, we view a few snapshots of what the interaction reviews are, our current collaboration with the ECHO team and the ECHO project around these webinars. This is the second in a series, or somewhat second and a half, because Jenny Waldorf has also done a series on mini pies and pies, and then the Sabin Vaccine Initiative Boost series as well. Next slide. Next slide. On the right-hand side, we've organized quick links. These are not meant to be comprehensive, but the most used links that we feel that donors are most interested in. And those include, as you see here, the complement to the NDVP uploads, which is the NDVP submissions itself, same spot, but from a different vantage point, and the CDS and other dashboards, which we'll show shortly. Next slide. Next slide, please. And so of these dashboards for which you can go in and take a look-see, I highlight one of them, which is kind of an aggregate global view of what the total current donor contributions are for COVID. Currently, we're mapped at 9.3 billion. We make a rough estimate that approximately 2/3 of those contributions, or even a little bit more, are most likely attributed to vaccine purchase within countries, with approximately less than 1/3 contributing to delivery projects. When you go into the platform, you can disaggregate this by country. So you can see what Nigeria, Bangladesh, Afghanistan, what have you, contributions are within the country. We show this because from the donor's perspective, they might want to see the large global view, and then they can drill down thereafter. We also have the COVAX delivery cost model paper, as well as a PowerPoint deck from February, and we hope to receive the updated estimates shortly. So we'll probably change this November to December, but those are eminently coming, most likely next week or soon thereafter. Next slide. Next slide. So the third box on the bottom, if you think about this, is just kind of like 3 different buckets, are other sources that we have noted that folks use quite frequently. Next slide. And these are examples of what those look like. We plucked the Afro dashboard here for an example of regional dashboard. Many of you may see in partner meetings. The COVID-19 dashboard, which Laura had highlighted in her talk, as well as the CRD website that many of you may use for toolkits and otherwise. On the right-hand side, we'll feature the Hopkins COVID behaviors dashboard in the next talk. Donald had touched on the vaccine market dashboard. And on the very bottom, we spend a lot of time understanding which vaccine products are under emergency use listing and pre-qualification, being very important for procurement deals bilaterally and multilaterally, and understanding requirements for receipt into countries. That's updated once or twice every week, every other week. And so that's the latest and the greatest as to which products have and their status on current authorizations for from the regulatory perspective. Next slide. So let's spotlight one of these, recognizing that I've thrown a lot of pieces at you. And I think it's worth, next slide, focusing on one particular dashboard that's coming online next week. Many of you may know that the CDS support window has opened for needs-based application, by which the template in the application provides us a rich amount of data around what many of you noted early on that you're lacking around financing and costing metrics. And this is a mock-up of a country X, if you will, and it's shown in 2 different views. On the left-hand side, what it shows is it shows a country's estimated costed needs, so the total on the right. I don't know if my arrow works. And then it's stratified by the 9 common costing categories that are in Chapter 4 of the NDVP. On the right-hand side, noted in black or illustrated in black is the same data, but stratified by the donor contributions. So if we take country X, that which is estimating the need of $18 million to support, I have a typo here, to support the country programs for COVID. 2 million comes from government domestic contributions. Another chunk comes from WHO, UNICEF, World Bank, donor 1, 2, 3, accordingly. There's a residual gap of $2 million, or wherever you want to put the comma in my hypothetical example. And so we have this thus far of 5 applications that have submitted their full request, as well as 1 short request. We will be able to filter this by either application type, and we'll be taking a look at the first set of submissions on this, in addition to the 16 plus civic tool sheets that we have from countries uploaded. It's definitely worth a pause here to follow on Laura's example, to thank all of you at the country level for carrying the burden and championing the cause of managing all these pieces of data, these data elements in response to all the requests for submitting. And so we recognize that this is a very heavy lift, and we really appreciate all the work that you're doing there. Next slide. I'm trying to figure out where we are on time, so someone can flag it for me, let me know. To give you kind of a view of what that country info page looks like, it was put together quickly in the emergency response. So it is all here. It may not be as ideally organized, but all the elements are here. And I highlight a few via these arrows. The NDVPs and the civic documents are here. The label has been changed. Other strategies such as World Bank and multilateral bank PADs and PIDs, project appraisal documents, are here in the second arrow, which is green. The Gavi CDS the documents are here, in addition to, we just onboarded the UNICEF files as well. Things like the Pfizer readiness checklist that was required for round 5 allocation, as well as the interaction reviews that have been downloaded from the extranet site and put into respective country folders. Next slide. Users on the platform is a quick snapshot. Next slide. And so 302, it looks like I'm still doing good on time. And so just to give you a quick and dirty idea of who's on the platform, we have around 45 total users that are active users, so duplicating and deleting those who haven't logged on for a bit. And then of those users, we have a little bit over 1,200 that are specifically vaccine users. About half of those users come from WHO, 604, followed by Gavi and UNICEF, with 191 users from respective ministries of health that represent 129 unique countries. You can see the bar graph here. Next slide. If we stratify the types of users by their role, there are many roles here in these really pretty colors on the right-hand side. And so to interpret this for you, approximately of the 1,200 Pillar 10 users, approximately 45% represent some form of country administrator, with approximately 13% that are specified as donors. However, if you take a look at the green circle, some donors may have been onboarded with a different label, if you will. And so we estimate that potentially up to about a quarter of the users on the platform could potentially be donors. And so this gives you a little bit of a glimpse into who's on the platform. Next slide. The last 2 slides I just want to touch on, because as we know, the response continues and shifts as we end this year and approach into the next year. And it's worth mentioning in these 2 slides, the Health Systems Response Connector. We are shifting from the Health Systems Connector to the Health Systems Response Connector in an attempt to be more responsive to country needs and to access gaps, and to focus on near-term response and coordinating and strengthening the country support. If we want to drive activities around response outcomes, next slide. And I leave you with this one slide that kind of captures the Act A pillars. As you know, most likely, many of you focus on our first pillar, which is vaccines. ACTA, the Act Accelerator, is access to COVID-19 tools, which also includes diagnostics and therapeutics. And the Health Systems Response Connector is meant to work horizontally across these elements to ensure that all countries have the necessary technical, operation, and financial resources. The reason that I bring this up is because there is an effort and a new data framework to track, connect, collect, and provide insights to countries around these value chains and product pillars. Of course, many of us focus on the vaccines pillar, recognizing that we work in a space amongst others. And so there'll be 3 huge data elements coming out: the C19 or COVID-19 Global Access Tracker, the COVID-19 Health Systems Readiness and Response Tracker, and the one that that you've heard a bit about today, which is the COVID-19 Partners Platform, a 2.0 version, if you will, that further integrates these other pillars, diagnostics and therapeutics, will be forthcoming in January 2022. I believe that's the next slide. So next slide. Great, brilliant. So why don't we see if there's any questions? It looks like we have 1 question on sharing the PowerPoints. We will do that, as well as the recordings, as we said before, so no worries. And it looks like many of the other questions were answered. It also looks like I might be 1 minute ahead. If there are any questions that folks want to queue up in this 1 minute, please put them in the chat box. Otherwise, I'm pleased to introduce our next 2 speakers that hail from Johns Hopkins Bloomberg School of Public Health. Happy to introduce and have with us today Marla, as well as Dominic, who will be talking about the COVID Behaviors Dashboard, and they hail from the Center for Communications Programs. Marla, over to you.
Thank you, Angela. Good morning, good afternoon, good evening. Thank you all for the opportunity to present the COVID Behaviors Dashboard today. Next slide. Before I introduce you to the dashboard, let me begin with a brief background on our center and our work. Johns Hopkins Center for Communication Programs, or CCP, as I'll refer to it throughout the presentation, was created to recognize the crucial role of communication in public health. Our organization is a leader in social and behavior change. USAID's flagship social and behavior change project, called Breakthrough Action, is led by CCP. CCP is part of the Johns Hopkins Bloomberg School of Public Health, housed within the Johns Hopkins University. We are the School of Public Health's largest center and the largest center of its kind based in an academic institution. We work in a variety of topical areas, and we use the latest in behavioral science research to guide the development of our programs. Next slide, please. Now onto the dashboard. We're here to demonstrate the COVID Behaviors Dashboard and associated resources available to public health professionals, those working in ministries of health, and those working with or at the WHO. Let me begin by explaining CCP's role in the visualization of these data. We, CCP, provide the analysis and content on the COVID Behaviors Dashboard, along with the World Health Organization's Global Outbreak Alert and Response Network, or GORN. Next slide, please. For us at CCP, this is a data utilization project, and our goal is to provide timely data about attitudes and behaviors related to COVID-19 vaccines and prevention to public health communication professionals and policymakers. Next slide. This project is a collaboration between CCP and GORN, as I mentioned, as well as the University of Maryland Data Sciences Group and the Delphi Group at Carnegie Mellon, who administer the surveys and facilitate data access. This work is conducted in collaboration with Facebook and its Data for Good initiative. And next, Dominic will walk you through the survey structure and methodology, as well as the recruitment process. Next slide. Okay, over to you, Dominic.
Yeah, thanks, Marla. So the dashboard presents data starting from May 20th, 2021, and we estimate that it'll continue through June 2022 at this time. Hopefully longer than that. Or potentially, maybe it's not needed. To date, there have been 19 million survey respondents and counting, about 110,000 each week. And these responses come from more than 115 countries. If you go to the next slide, please. The survey is broken into 6 parts. You can see on this slide the 4 main sections of the survey: COVID symptoms, testing, vaccine acceptance, and prevention behaviors. Those 4 sections are administered to all of the participants, and there are 2 additional sections that are randomly administered to half of the participants. We refer to those as modules A and B. Module A includes questions on beliefs and norms, knowledge and information, and healthcare. Module B includes questions on well-being and parenting behaviors. If you go to the next slide, please. I want to take a moment to discuss the logistics behind pulling these data together. The dashboard contains weighted descriptive statistics. The weights are adjusted to the weights adjust the distribution to match age and gender in each country. And we display longitudinal change over time in the dashboard. You'll notice that there are gaps in the data, particularly when you get to disaggregating by subgroup. This is because we maintain a minimum of 100 participants within any data grouping. Next slide, please. I wanted to share the recruitment and enrollment process very briefly here, as this sparks a lot of questions, and we have a lot of answers to these things as well on the methods section of the dashboard. There are multiple links within the dashboard that provide those details about weights and other aspects of the data as well. Individuals who opt into this study are recruited through advertisements on Facebook. They're then pushed to a remote server managed either by Carnegie Mellon, if the individual comes from the United States, or the University of Maryland, if the individual comes from other countries around the world. Participants are then consented and shown a battery of survey questions. Data are later made available through the project's APIs. There is no individual level data that is shared back with Facebook. All survey responses are self-report, and this includes age, gender, education, and location of residence. So there is no direct data transfer between Facebook and the data collection agencies. Participants can opt out of any question in the survey. If you'll go to the next slide, please. Here I've listed a few of the study limitations. And for starters, we see differences in the sample demographics of the survey and the demographic estimates for each country. Our sample tends to be more male, more urban, and more educated. The survey also excludes individuals not on Facebook. And due to the global nature of this survey, you can imagine that this often leaves out those who need health services the most, such as individuals without cell phones who happen to be lowest income. The statistics in the dashboard were limited to individuals who reported demographic characteristics. So incomplete demographic information varies across countries, but in some cases, this presents a challenge and limits the data that is presented on the dashboard. So as mentioned briefly before, the construction of modules A and B also pose a challenge for conducting any full survey analysis. Random assignment in these variables, random assignment of these variables to 50% of the sample limits our ability to analyze many variables at the same time. Sample weights are only constructed for 71 of the countries, and all of those countries are presented on the sub-national dashboard, which we'll talk a little bit more about later on. Other countries are left out due to this limitation. So there are often questions about the enrollment funnel, and there's a forthcoming document on this that we're waiting to get from Carnegie Mellon and the University of Maryland. And the most I can say about this right now is that the enrollment rate reflects many similar online surveys. And I know this is a list of limitations, but I want to put this out in front. We want to be transparent about these data, what they can share with you and where the limitations are, as we do get a lot of questions about this. And as I mentioned before, in our methods section, in the Q&A section within the dashboard, there are some responses to this that should be able to answer questions, and you can always reach out to Marla and myself. So next slide, please. So when we released the dashboard in September, it only had this global view. Now we have a sub-national option, which allows you to select a single country and explore the data within that country. You can also download a country report, which summarizes the data for an entire month. And the report is available for all countries. And when the sample size allows, it allows for a sub-national report as well for our country. To find your subnational report, select your country on the map and click Print Report, and you'll get a downloaded PDF. I'm going to walk you through a few of the visualizations in the dashboard and highlight some of the data from Nigeria and Ghana. Next slide, please. We've created visualizations that fall within these 4 topics: vaccine, behaviors, knowledge and information, and testing. Next slide, please. The first visualization in the dashboard is a bubble chart of vaccine acceptance among the unvaccinated participants. The gold bubbles represent unvaccinated participants who say they will definitely not get vaccinated. And the light green bubbles are those who will probably not get vaccinated. The blue bubbles are those who are definitely or probably going to get vaccinated. So as you can see, in October, in Nigeria and Ghana, the majority of unvaccinated respondents say they will definitely or probably get vaccinated. All right, go to the next slide, please. You can explore the trends for most of the visualizations in the dashboard by clicking on the icon on the left-hand side of this slide. These trend graphs are showing the percent of unvaccinated participants who do not plan to get vaccinated since May. In Nigeria and Ghana, this has barely changed, just hovering around 40% over time. It'll be important to watch graphs like this over time as vaccines become more available, which you can also track through what Laura was mentioning earlier in her presentation. If you go to the next slide, please. This slide contains the vaccine acceptance rate among unvaccinated individuals at the subnational level in Nigeria. Vaccine acceptance rates combining the blue and yellow sections of the bar graph vary between about 50% to just under 70%. In Lagos, we can see here that vaccine acceptance is 66%. If we go to the next slide, please. The survey asks the unvaccinated why they are hesitant. The gold bubble on this graph is the global median for each response. The gray bubbles in this graph are the data for the WHO African countries, and the blue bubble is the African median. As you can see, the most common reasons for hesitancy in Africa are fear about side effects and planning to wait to see if the vaccine is safe. These are also the top 2 reasons globally. Ghana ranked among the highest in concerns about vaccine side effects, with over 66% of unvaccinated participants selecting it, which is above both the regional and global percentages. Fears about vaccine side effects therefore indicate a key area to address in COVID-19 messaging, which could also ease some of those fears in Ghana and also Nigeria. If you'll go to the next slide, please. The survey also asks the unvaccinated to identify the structural barriers keeping them from getting vaccinated. These are presented for each country in a spider graph. This is the spider graph for Nigeria, which identifies 4 main structural barriers: no vaccine appointments, difficulty getting time away from work and school, appointment times did not work, or difficulty traveling to the site. The lack of vaccine appointments ranks well above the other concerns, indicating a key area where vaccine rollout strategies can affect the barriers to vaccination. And as more vaccines, again, kind of what we're seeing today in this presentation, in this webinar, is how do we kind of, Marla and I have been messaging on the side, how do we integrate some of Laura's data with the data we have? And that can be a kind of a next step for our dashboard as we move forward. But I think this is a good example of how those things can be married in this structural barriers visualization. If you go to the next slide, please. The survey asked all respondents how worried they are about catching COVID, and the responses are varied. I've highlighted Nigeria here, where 34% are a great deal worried and 19% are moderately worried. This slide also highlights the demographic breakdown of these data. You can explore the degree of worry in Nigeria by gender, age, and further below education level. So on the right, when you come to this graphic on the dashboard, you can scroll down in this section on the right. This may be helpful for programs who are targeting different subgroups of demographic groups and communication campaigns. We'll go to the next slide, please. If you'll go to the next slide, please. In the survey, respondents report their own prevention behaviors, including mask wearing. Among the African countries, self-reported mask wearing is highest in Mozambique, South Africa, and Angola, between 89 and 94%. It's lowest in Tanzania and Mauritania at 34 and 35%. In Nigeria, 58% of respondents reported wearing a mask, and in Ghana, that number was 76%. You can map the results of other behaviors as well as perceived norms within the dashboard and make that juxtaposition of countries. If we go to the next slide, please. You click it one more time, please. Thanks. This figure presents trust in COVID information sources on the x-axis and exposure to information sources on the y-axis. Participants are asked about 8 different information sources, from WHO to journalists to healthcare workers. The bubbles in this chart represent all of the countries in the African region for each of the 8 sources. As you can see, the Nigerian respondents had relatively low trust in politicians and journalists, and high trust in CDC and WHO and science or health experts. However, less than 50% reported being exposed to either of those trusted information sources, indicating a gap that could potentially be addressed to push messages out. These are important considerations as we decide who are the best messengers for important health information to be disseminated in a country. If you go to the next slide, please. These data can also be viewed more simply by country, They can also be viewed more simply by each country. Here we can easily see that scientists and health workers are the most trusted source of information for Nigerians and Ghanaians. If you go to the next slide, please. Lastly, I wanted to show the percentage of respondents who self-report that they have ever had COVID-19. This is about 11% in Ghana and 23% in Nigeria. This is an important indicator, as many people believe that natural immunity results from a previous COVID infection and is protective against COVID, and they may not go to get a vaccine. Those individuals are potentially prime candidates for vaccines, and messaging could be developed for them. So now I'm going to pass it back to Marla, and she'll wrap up this presentation in a moment. Thanks. Next slide, please.
Thanks, Dominic. So the data that we just reviewed are available in the global dashboard, which is updated every 2 weeks. And the subnational dashboard, or the subnational view, which contains data for 71 countries, is updated every month to increase sample sizes for some countries and push them over that 100 respondent threshold, which allows for a more robust presentation of that data. Here, you're looking at the country report for Nigeria and Ghana, and like the subnational dashboard, these are updated monthly. So these are the latest versions of the report. These are easily shared and customizable, meaning for those countries with subnational data, you can pick and choose which states or provinces you'd like to print a report on. So next slide. I just wanted to quickly share some data use examples from some other organizations that we've heard. Next slide. So one example is to identify message content. We have been working with a group in Kenya, a USAID-led COVID technical working group that's using the dashboards to identify reasons for hesitancy to develop messaging campaigns. We also have been in touch with a country office of CCPs in the Philippines that's using the dashboard to guide training materials around in selecting a channel and format for their interventions. They're using that trust and information graphic that Dominic showed earlier. We also have seen use by organizations such as USAID and their missions, foundations such as Gates, UNICEF, WHO, corporate and private firms such as pharmaceutical companies, universities, and other researchers, as well as the media. Journalists are an audience for this dashboard. We're hosting a webinar ourselves tomorrow at 9:30 Eastern time to highlight 4 specific use cases. And Dominic, if you could put that link in the chat, if anybody's interested, that link will tell you more. So next slide. So additional features on the dashboard include a guided PowerPoint template that walks through the development of a slide deck using the visualizations on the dashboard. This is for those of you who are presenting to our CCE committees or other organizations or other individuals interested in the data from the dashboard. We also have additional analyses in the form of technical briefs that will be linked to our dashboard very shortly and disseminated via social media. So to be notified of those updates, you can join our mailing list, and the link to that is on every page of the dashboard. So with that, that ends our presentation. I wanted to turn it back over to Angela and thank everyone again for their attention. And next slide. This is how you can reach Dominic and I. We're happy to answer any questions. Thank you.
Great, thanks so much. And thanks to all the speakers. It's been a really nice compilation of highlighting of not the entire universe, but a lot of key points. I don't see any questions in the Q&A box, but I do want to flag that we have answered all the questions either live or in writing. Laura kind of poses whether or not our dashboard at WHO was user-friendly, defined as clear with a purpose, identifiably easy to navigate, and visuals are comprehensible and easy to understand. We have a comment here from Mona. I'm not sure if it's meant for the group, about using the same instrument for the survey to assess detailed country level vaccination status and hesitancy. And so we do have Marla and Dominic's email there if you want to direct those to them. Marla, I'm not sure if you understand the question or if it's directed to you, but if you want to take a stab at it, or Dominic, please do. It's in the chat box. Otherwise, perhaps via email might work. Would you like to comment on anything as I look at the newer question that just came up? Okay. The last comment, or the only question I have in the box is there a certificate? When and where can I receive it? And so we'll cover that in the closing slides. So yes, and there'll be a link to where you can receive that and how. Also, there's all these help emails if you need help. And it looks like, thanks to Arumina, that that explanation is in the chat box. So I don't know, a round of applause to all of our speakers as we move on. Thank you so much. As we move to the next slide. So what's next? I believe before we get into what's next, we have two closing poll questions. Echo India, could you put those poll questions up? And so those poll questions are: this ECHO session was helpful in identifying what COVID-19 and COVAX related data are available and where to find such data. Yes, somewhat, or no. The second question we have for today is, following today's presentation, where do you see the greatest information gaps? And where can investments, for example, from donors or multilateral development banks, be directed to fill these gaps? And the choices are: understanding what vaccine supply can be expected. So these are the same answers as earlier: absorption capacity data, costing and financing related metrics, vaccine confidence related metrics, disaggregated program related metrics, and delivery related indicators around progress and challenges. So if I can ask y'all to answer those questions, let's shift to the closing comments while folks have a chance to click. Next slide. Or close the polls, or actually maybe I need to click something. Oh, look, I did need to click something. Our webinar materials, as many have asked in the chat boxes, can be found in a number of places, perhaps most easily on the TechNet21 website, as well as all the things that Alex has placed in the box around Telegram and others. You can continue to ask your questions and continue this conversation, both via the email addresses provided in the deck, as well as here on the TechNet forum on Telegram. Next slide. What's next? The recordings from this session will be available in English, French, and Spanish. to give you a preview of one of our last 2 ECHO sessions. Next week, we'll be hosting a session on vaccines impact modeling, key issues to know about modeled evidence to inform prioritization and delivery. You can register for this session as well as the very last session at the links provided. Next slide. This is probably the most important slide of all the decks, of the entirety of the deck. I want to first and foremost thank the translator, but don't leave yet because I want to show you the poll question responses. The translators for always an excellent job. Any questions related to the sessions that weren't answered will be shared with the technical experts and answered and shared via email. Before we lose everyone, why don't we post the poll responses and see what we have? Echo India when you can. So it looks like that this session was helpful or somewhat helpful. It's nice to see that there were no no's. In terms of where folks feel that there should be more investment, some consistency that we've seen in other ECHO sessions around costing and financing metrics. We have a fair proportion around absorption capacity and a little bit in each of the buckets. Thank you for answering those questions, about half our sample. And next slide. That's it. Thank you again to all who've attended, all the work you do at the country level. Thank you for all the support from ECHO India and our translators. And thank you to all of our speakers who were quite thoughtful about the presentations, who did a great job of presenting a lot of data and accommodating slides and deadlines overall. Have a great afternoon, evening, morning. I did that backwards. And thanks to everyone. Cheers.